All right, so let's go ahead and get started. If this is your first time using GoToWebinar, we encourage you, because we're live, to participate in the webinar. You can do that by asking a question in the question box, typing something in the chat if you have a question or comment at any time throughout the webinar. Or if it's easier to ask your question out loud, you can raise your hand and I can unmute you. Everyone is currently muted, and I can unmute you, and you can ask your question out loud to me and I can answer back verbally. Um, so this is an advanced webinar, meaning I'm assuming that you all know a little bit, at least, about the HRS, the Health and Retirement Study in the US, and the HRS sister studies internationally. So today what we're going to be doing is actually using some of that data to do kind of a sample analysis as a helpful way to talk about some issues that people run into when doing cross-country and longitudinal analysis using these data sets. And my name is Tristan Phillips. So I think it's easiest to start off by asking a research question. So the question we're going to be asking is, are there country-level differences in the longitudinal patterns of disability onset by gender, urbanicity, education, or wealth? So you can notice that we're doing a couple of things here. So we're going to be looking at things across a few different countries, 3 in this case. And because all these studies that we're using are longitudinal in nature, meaning that they re-interview the same respondents generally every 2 years, we're going to be kind of exploiting some of that longitudinal nature of the studies to look at changes over time or longitudinal patterns. And we're looking at disability onset. So when someone might go from not having disability to having a disability. And we're going to kind of look at some different factors that we think might be correlated or might not be correlated, or might have an effect, or at least an association with disability onset. And those are going to be gender, urbanicity, so whether someone is urban or rural, education, and wealth. So the data sets that we're going to be using are going to be, the studies we're going to be looking at are going to be HRS, which is conducted here in the United States where I am, and the Harmonized Share, which is conducted in around 30 countries in Europe and Israel. So those are the two we're going to be using just for this sample analysis. We have harmonized data for many countries. I think we have 7 harmonized data sets that are currently available for different studies in different countries. A few of, like Share itself, has many countries inside of it, although generally with the other ones, it's 1 data set per country. So we're going to identify some comparable measures in the HRS and Share. We're going to create a pooled data set with observations from both harmonized data sets. We're going to prepare our variables. We're going to apply weights. I'll talk a little bit about that. And then we're going to analyze disability prevalence across countries. So prevalence meaning just what is the rate at any given one point of time of how many people have a disability or experiencing some kind of disability. And then we're going to analyze disability onset, meaning kind of exploiting that longitudinal nature. So seeing when people start to acquire a disability over time, so we can follow people from a state of not having a disability to when they have a disability. And we'll do that by countries and then by some of those other factors that we just talked about in our research question. So the first step is we'd want to download the RAND HRS and Harmonized HRS data. The RAND HRS, if you're unfamiliar with it, is a really simple, easy to use version of the HRS data that's produced by the RAND Corporation. So it's cleaned, it's very user-friendly. And a lot of the research that comes out of the HRS uses the RAND HRS because it's so user-friendly. Here at our center at USC, we've also created the Harmonized HRS, which we've just released as of yesterday, and we're very excited about. And this includes variables which are not included already in the RAND HRS, but might be helpful for researchers also. The RAND HRS is just a subset of kind of all the questions or variables that are contained inside of the HRS. So this is kind of an additional data set to kind of help you for your research if the things that you're looking at might not be included in the RAND HRS. Both of these can be downloaded through the HRS website, which I have listed here, which you just have to register. It's quite simple. So you can register and download those. Next, we'll have to create the harmonized share. And I'm not going to do this on screen because it would take a little too much time, but I will kind of overview how to do that. So in the case of the RAIN-HRS, you can just download it. But for the harmonized share, you're actually going to have to create it, but don't worry because it's not much work. So what you would do is you would go to the Share Research Data Center, and you would download the Stata data for share waves 1 through 6, basically, and that's release 6.0.0. You also download a longitudinal weights file and an all waves cover screen file. Then from the Gateway to Global Aging data, and I'll show you this on the website, you would download the harmonized share Stata creation code. Inside the Stata creation code, you would open that up. It's a Stata file. You just have to edit 2 lines of that to list where you stored that share data you downloaded. You're going to run that once in share, and then you'll have the data set. So you only have to do that process once. You can also download the harmonized share codebook from the Gateway to Global Aging data. So let's quickly look at our website. So this is the Gateway to Global Aging data. It's on the web at g2aging.org. I had one comment here which says the mic is cutting out from Don. Is anyone else having issues hearing me? Is the mic perhaps cutting out? If you could just let me know. Irdashki had a question. Your hand was raised. Joe says no. Irdashki, did you want to ask a question? I'm sorry if I'm pronouncing your name incorrectly.
No, that's okay. I just want to say that I had the mic cut off a couple of times too.
You did also. Okay. If you could just let me know, just typing it in the question or the chat, if that happens again, I might just need to stay a little closer to the mic throughout. I apologize for that. And Rita just asked the question, hi, just data code, no other program languages. So in the case of downloading the data set, so let's look at that. And we can use this download page we have on the Gateway to Global Aging data. And if you click download, you can see here links to download all of the different studies. So you can see here we have data for HRS, MHAS, ELSA, SHARE, Corellis, CLOSA, JSTAR, TILDA, Charles, and Lassie. You can have a link to download the original survey data. So this is, for instance, where you would go to download SHARE from the Munich Center for the Economics of Aging here, and you see Stata code below. In the case of most of the other data sets, you can download the data set directly, just like with the RAIN-HRS or Harmonized HRS. When you download the data sets, usually they're provided in SAS, SPSS, and Stata format, so you can kind of choose which one you want to download. In the case of Share, we do have just one program, which is Stata, to run it in. So we don't kind of reprogram the whole creation thing in different programming languages. So if you're not familiar with Stata, as long as you have, let's see, Rita said, sorry, I meant the harmonization code for Share. Yes, exactly. So that Stata creation code, that code is just in Stata. So you have to use Stata at least once. Once you run it in Stata, you could then convert it to SAS or SPSS or any other program, R, for instance, that you might be interested in using. And we have more information about how to do that here. There's this link at the bottom for more information about obtaining harmonized data sets in formats other than Stata. You can click here and find out more information about that. But basically, you would have to use Stata at least once. So apologies for that. So now we've got both of our data sets, our 3 data sets here for our 2 studies. So we're going to identify comparable measures in the HRS and Share. And using the Gateway to Global Aging data, you can do that through documentation, concordance search, or harmonized codebooks. So the kind of comparable measures we're going to look for is we need a measure of disability. And in this case, we're going to kind of proxy for disability by using activities of daily living, or ADLs. This is kind of a functional limitations thing. We can look at that. We'll look at gender, level of education, an indicator for whether urban or rural, and total family wealth in this case. So let's look at a couple different ways you could find those. One would be the concordance search on the Gateway to Global Aging Data. So you can click the concordance box at the top there, and then you could click on, for instance, RAND HRS, Harmonized Share, and you can go down and say we can select gender because we're interested in gender. And we could say search. And what we'll get there are the gender variables which are related, which are inside of the RAND HRS and inside of the Harmonized Share. So we can see that there is an RA gender in the RAND HRS, that's the respondent level gender. You can also see that we have the spouse level genders, which we won't be using now. And in the Harmonized Share, it has the same variable name of RA gender. And that's really what we mean by a harmonized variable, or these harmonized data sets. So both of these studies ask about gender, and in the data sets, these variables are named exactly the same way and they're coded the same way. So the code, the value for male and the value for female are exactly the same in both studies. You could also use the harmonized codebooks, as I mentioned. So each of the data sets are distributed with a codebook, which includes lots of documentation. You can download any of the codebooks from our download page, or often when you download the data set yourself, you get the codebook with it. So for instance, this is the RAND HRS codebook. And using bookmarks, you could, for instance, go to, let's look at that ADL variable. So using our bookmarks, we'll go to ADL summary. And you can see here we have a summary, 5-item summary. This is perfect. This is what we'll use, called R for respondent, wave number, ADLA. And if we scroll down here, we can find some more information about how that's created. So this variable we're using is the sum of whether having any difficulties, or the number of difficulties from a question about whether you have difficulty bathing, dressing, eating, getting in and out of bed, or walking across a room. So if any respondent answers that they have a problem with one of those, they would have a score of 1 for ADLA. If a problem with all of them, they would have a score of 5. A problem with none of them, they would have a score of 0. So we could use our codebooks or the concordance search to find variables in any of them. I'll also show you the Harmonized Share codebook, which is organized very similarly to the RAND HRS. So we can find that exact same section, ADL summary, and you can see that here we have exactly the same variable that's created for share with the same variable name. So that's perfect. So first we're going to identify selected variables in the RAND HRS. So we're going to pick our year of interest here. And we want to use kind of the longitudinal nature, as I mentioned, of these studies. So we're going to look over years 2004 to 2014. So we'll have a 10-year span. 2004 is wave 7 of the HRS. 2014 is wave 12 of the HRS. So the first thing we're going to use is person and household identifiers. We always want to keep in our identifiers whenever we make a data set, in case you want to go back and merge in some other data later. So we'll use our identifiers. We'll use that 5-item ADL summary. We use that both in 2004 and 2014. So we can look at change between those two different waves over that 10-year span. So those variable names are going to be R7 for wave 7, ADLA, and R12 for wave 12, ADLA. We use our gender variable, which we saw, which is RA gender. Our household wealth variable in 2004. So what we're going to do is we're going to see if kind of the onset, the change from 2004 to 2014 is associated or is kind of correlated with any any of these factors in kind of our baseline, our in 2004 that we're looking at. So we'll use household wealth, total household wealth, which is H7ATOTB. We'll use age in 2004. We also need an analysis weight. The HRS includes an oversample of Black and Hispanic individuals. So we want to make sure that we're accounting for both some of the non-response bias, which happens for certain groups, and the oversampling in the HRS. So we're going to use these analysis weights to make sure we're getting population estimates and not just estimates of our sample. And we're going to use a household analysis weight also. That's R7WTH. And then we're going to use some variables from the Harmonized HRS. So as I mentioned, the Harmonized HRS is kind of an addendum to the RAND HRS containing other variables that might be of interest. So in this case, there's a couple of the variables that we need that aren't in the RAND HRS. And in particular, those are an internationally comparable education variable that's named RADUCL. So this uses ISCED equivalent scales in different countries to kind of get an idea of how education can be compared across different countries. And then we also want an indicator of urbanicity, or whether urban or rural, and that is named H7R rural. In this case, H is for the household, because we know that everyone in the household would either all live together in a rural area or in an urban area together. So those are our HRS variables. And now we're going to take our share variables, our harmonized share variables. So the first thing from share, as I mentioned, share is a multi-country study. So we're going to use a variable called ISO country, which is going to let us know which country that respondent is part of the sample for. We're going to include our person and couple level identifiers. So one of the differences between the HRS and share is that in the HRS, just one respondent and a household member is interviewed. In share, everyone who is age eligible in certain waves is interviewed. You can see some of those differences by going to the Surveys tab of the Gateway to Global Aging Data. And if you go Study Overview, one of the things that you can see here is respondent eligibility. And then you can have one or all age eligible people included. You can see in HRS, it's one, and in share, it's one here, but with a note, which lets you know that the original wave 1 sample of share interviewed all age eligible individuals in a household. So kind of an idea is that we're going to have to use a couple for share, where what we call a household in the HRS is a couple also. We have our 5-item ADL summary for both 2004 and 2014. You'll notice we're looking over the same years here, but 2004 is wave 1 of share, and 2014 is wave 6. So we're going to have to account for those variable names being a little different. We have our gender variable. We have an internationally comparable education variable, exactly the same variable as we saw in the Harmonized HRS. A variable indicating urban-rural, our household wealth variable, our age in 2004 variable, and then we have an individual analysis weight and a household analysis weight. So there's all our variables. So we know what variables we want, we know what kind of questions we're trying to ask, and we've already acquired the data. So we're going to be using Stata to do this analysis. As I mentioned, there is a handout for this webinar. It's named advanced_HRS_webinar.doc. That's actually a Stata do file. So I'm going to be kind of using that do file if you just change the extension from .doc to .do. I'm going to be using that for the rest of this analysis. So I'm going to quickly switch over to Stata. If you've downloaded that do file, if you want to follow along, all you need to do is open it. So we can open our do file editor here in Stata. And then wherever you have stored that do file, you can open it up. I'll open it here. The only things that you need to change are the location where you have stored your data. So you can see this is where I've stored my 3 different data sets that we've talked about here. And then this do file has pauses in it. So if you want to run along with it, you can start to run at once. You do that just by clicking this run or execute.do file here at the top, this button with a blue arrow. So we can click that. Our do file will start until it hits a pause. And once it hits a pause, we can type some more commands or follow it along. And then when you're ready to jump to run the code again, you can type Q to go through the pause. Let's see, we have one more question here. Can you please explain where to find the DOC file? It doesn't have to be now, sorry to interrupt. That's absolutely fine. And you can follow along on the screen. It should be in the handout section of GoToWebinar. For me, it's just on my screen. I see there's a handout section. If anyone else knows exactly where it is on their screen, perhaps they can let Stephania know. But it's the advanced HRS. Let's see, could you provide the handout as a text file? Yes, so the .doc is actually a text file. So you can see exactly the code there. Stata code is just actually a text file also. There's nothing that's encrypted about the programming language itself. So you should be able to just open that DOC file as a Word document or using any kind of text editor program, and you could follow along. All right, so the first thing we want to do is we want to read in the RAND HRS observations and variables. So we'll do that in Stata saying use. We're going to list out all those RAND HRS variables that we want, and we're going to say using the RAND HRS data. We want to remember, even though we're going to bring in more countries, that everyone who we started with is in the US. So we're going to create a variable called ISO country, and that's going to be equal to 840, which is the ISO country code for the United States. That's maybe a complicated way to remember that they're from the United States, but it works for me. And we're also going to generate a variable called study, and that's going to be equal to HRS as a text string, so we can know these people came from the HRS. So we know that everyone in our data set currently is from the United States, and they're part of the HRS sample. The next we want to do is merge in the harmonized HRS variables. So we can do that using a merge command. The merge command in Stata works by saying merge, the type of merge, and in this case, both our data sets are respondent level, so we can say a one-to-one merge using our unique respondent identifier in both data sets, which is HHIDPN. And then we're going to keep using, we're only going to use those variables from the harmonized HRS, our education variable, and our indicator of rural urban. And then on our next screen, we can read in the harmonized share observations and variables. So we'll append. So append is different than merge. So what merge does is merge assumes that the observations in your data set can match the new observations you're coming in. But we know that no one who is in the HRS is also in share because they're for different countries. So what append does is append takes the observations from the appending data set and puts them below the current data set. And it adds any extra variables which aren't already included to the right of the current variables, if you're kind of looking at what it looks like. So we can append using hshare. We're going to keep just those variables we're going to use, and we're going to generate a variable called append. And that append variable is helpful because we can use that to remind ourselves which variables were just read in. So then we can use our study variable which we created and say that everyone we just read in the append is going to be from share, just the string text of share. Lastly, we can apply codes that we use for ISO. So we're going to just be looking at 3 countries in this case. Share has, as I mentioned, almost 30 countries included. We're just going to look at 2 share countries and the HRS for simplicity. So we're going to look at USA using the HRS. From share, we're going to look at Greece and Sweden. So I think we have kind of an interesting grouping of different sorts of countries here. So the last thing we're going to do is we're going to drop everyone else, right? So we're only going to include people who are from those 3 countries. So we're going to drop out all the other share observations from different countries. So if we jump back over to Stata, one thing I can show you is if we use the data editor and browsing, you can see here we've got all our HRS variables, and we can probably get to a point here where you can see underneath the HRS variables, the HRS observations, we get these share observations. So this is sometimes helpful to see exactly what append does. So right underneath our HRS observations, our HRS observations are our share observations. So we switch from share to HRS, and you can see those variables which are only inside of share here to the right. So jumping back in Stata, we can tab and just make sure this looks all right. We can also check our, so tab ISO code, and we'll tab our study variable. We'll do a cross tab here. Let's see, ISO country. All right, so you can see, thank you, Aju. Yes, so you can see that we've got our observations. So we've got, from HRS, we've got a total of 37,000 observations. Of course, those aren't going to all be just in the waves that we're looking at, but that's total over the whole HRS waves 1 through waves 12. And from share, we've got about 6,000 observations each from Greece and Sweden. So we can type Q in Stata to go to our next step, and I'll show that on the screen here. It might be a little easier in the slide. So the next thing we want to do is we're going to prepare our variables. So a lot of this, because we have variable names which are already coded the same way and generally the same besides the wave number, we just need to adjust for the different wave numbering in the variable names. So instead of using the wave number in the variable name, we're going to start to use the year because we're looking over the same years in different studies. So we're going to, for our 2 ADL variables, both in 2014 and 2004 and 2014, we can generate that variable. We know that if they're coming from HRS, that their value is going to be stored in R7 ADLA, and if they're coming from share, it's going to be an R1 ADLA for the 2004 variable. Similarly, for the 2014 variable, their values are going to be stored in R12 ADLA if they're from the HRS, and R6 ADLA if they're from share. Continuing on, we have our wealth variable, so we're going to do something very similar. This is wealth in wave 7 of HRS, wealth in wave 1 of share, both in 2004. We're going to do the same thing for the age variable, same thing for our rural variable, the same thing for both our weight variables. So we have a person level weight and a household level weight. We'll do exactly the same thing. I think you probably understand here. And lastly, for our household ID, we're going to do the same thing for the household ID. So go back into Stata. Let's see there we've created our wealth variables, our ADL variables, our urban and rural variables, and our household ID variables. The next thing we're going to do, so as I mentioned, our ADL difficulty variable is a sum of how many of these 5 ADL questions they have a problem with. And we're going to simplify this a little bit, which can be helpful for just for our analysis today. And so we're going to be making a variable which is whether you have any ADL difficulty, right? So if you have 0, your any variable is going to be none. And then if you have 1 through 5 difficulties, you're just going to be coded as a 1. So you can do that using an egen command in Stata. This is kind of an enhanced generation variable command. So we're going to say we're going to make one for 2004 and 2014. And we're going to use our ADL variables that we just renamed. And we're going to say cut at 0, 1, and then kind of the top of our cut is 6 because no one has 6, right? So we're going to make those variables. And then we're going to create an indicator of whether able individuals experienced any onset of ADL. So again, one of the things I said we're going to be looking at is the change between 2014 and 2004 and 2014. So we're going to call this variable R 2004 any ADL X or change, right? And what we want to look for are people who had no ADL difficulties in 2004, and then two outcomes could have happened by 2014. One is in 2014, 10 years later, they still didn't have any difficulties, and we'll assign those people a value of 0. Or they've acquired, we know, at least one difficulty, could be up to 5 difficulties by 2014. And those people will have a value of 1. So let's look at that in Stata. So using our Q in Stata, we can have our change variable. And of course, as I said, once we've kind of have a pause, we can test some things. So we can sum our change variable just to see what it looks like there. Yep, so we can see it goes from 0 to 1. We could also tab it. Yep, so we have a yes and a no there for the different values. So we can see overall these people, in general, more people did not acquire an ADL in our sample, at least, than did acquire an ADL. The next thing we're going to do is slightly complicated, and I'm going to just explain it quickly. I'm going to make all these slides available and the video from today's webinar available by tomorrow morning. So you can, by tomorrow morning on the Pacific coast of the U.S. So you could download this to learn more about it, and you have this data code, of course. That'll also be on our website. But what we want to do is we want to create wealth tertiles. So someone is either low, middle, or high family wealth. And to do that is slightly complicated. So the first thing we want to do is, because both our data sets are respondent level, we just want to make sure that we're only accounting for one household. There's only one observation per household, and we can do that using a tag kind of variable that we create, meaning that only one observation of that household is going to have the value of 1, or it's a tag. And then we're going to create our wealth tertiles using this command called xtile in Stata. So we're going to xtile our wealth variable. We'll make one for the US, for Greece, and for Sweden. Of course, these are going to be inside of each country. These are country-specific wealth tertiles. So we're not assuming that being wealthy in the US is the same thing as in Greece or is the same thing as in Sweden. But we'll have different subsets for each country. We'll use our household level weight that we have, and we're going to only do this if the tag is equal to 1. So we make sure that we're only doing this one observation per household. And then in that second line, the by-sort command, we're going to copy that value to the other household respondent or the other household respondents who might also share that value. And then lastly, we'll make one variable, which is just their level inside of each country. So that's really quick. I think this is a question that a lot of people have, a question about what to do when you have some variables which represent a household or a couple and some that are respondent. So I know that was quite brief, but hopefully if this is of interest to you, you can go back and look at it later. And if it's not, then don't worry about it at all. So inside Stata, we will skip through that, and we can quickly tab our variable here that we created, and let's tab it by ISO country. So you can see there inside of Greece, we've got low wealth, middle wealth, high wealth people, same in Sweden, and same in the USA. So that looks perfect. Looks like we've got some decent sample sizes there for all of those. So the next step is we might want to look at things at different ages. So to do that, we're going to look at 3 different age cohorts. So we'll do that by using the egen command again. So egen R2004 age category. Egen command is going to use cut again. So we're going to look at people who are 50 to 59, 60 to 64, and 65 to 69. So just over 15 years, 5-year age bands. So we'll make that variable. And then we're going to also create a flag for who is in our sample. So our sample is going to include anyone who is in our age categories, our 3 age categories, which have the values 0, 1, and 2 in the R2004 age categorical variable we just created. And anyone who isn't missing the change variable, right? So it's someone who is inside of who we know followed from 2004 to 2014, and they gave us an ADL in both of those waves, and it either changed or stayed the same. So we're going to be losing some people here. So we're going to be losing people, of course, who died in between those waves, people who were lost to the sample in between those waves. So for a more serious analysis, we might want to look at who we're excluding here to know how that might bias our estimates. But for now, we're just going to assume it, and that's something we can all think about, who might be excluded by how we've defined our sample, and that's always an important thing to think about. So inside of Stata, we'll go through that, and we can tab sample ISO country. Probably ISO country sample is going to give us a little better printout there. So you can see inside of our sample, we're going to have 780 people from Greece, 800 from Sweden, and almost 6,000 from the U.S. So the U.S. sample size is quite larger, and although for Greece and Sweden, it's a little small, I think we'll be okay for this analysis, but it might affect our standard errors. We might have trouble getting kind of precise estimates with smaller sample sizes here. So that's just something we want to know going forward. All right, so we prepared all our variables. Great job. That is often the longest and most arduous part of creating any analysis data set. So the next thing we're going to do is we're going to apply our weights. So we're looking at disability onset. And in this case, we're going to use our 2004 respondent level weight. We also have a household level weight, but here we're talking about something that happens to individuals. So we'll use our respondent level weight, and we'll use this data command svy set. We'll say our probability weight is R2004 p weight. And then here we're defining a strata, which our strata is country. So because weighting was done separately for each country, we want Stata to know that the weights for Greece don't equate to the weights for Sweden or for the US. So defining a strata here kind of defines the parameters of those weight values by country. So that's important to do here. In Stata, using Q, you can see that. We can also do a little printout here of how our weights are working. So you can see that we have our 3 strata for 300 for Greece, 752 for Sweden, and 840 for the US. So we have our 3 strata. You can see the number of units, the number of observations in both. So the first thing let's do is let's analyze prevalence. And as I mentioned before, prevalence is just going to be the amount of people with any disability, in this case, at any one point in time. And we'll do that in 2004, kind of what is our baseline. So we're going to be looking eventually at the change over time. But let's look first if whether there's just any change, any differences by country in prevalence. So we can do that in Stata. What we would do is we would say SVY, which in Stata is helpful. It's one of the nice things about using Stata with survey data is whenever you say SVY, comma, and then a command, it's going to recall the weighting that you said when you set SVY set. So you don't have to continually type in different weight and different strata each time. So we're going to say SVY. When you use an SVY command, It's also important to define your subpopulation so it can know which weights works are being excluded and which are included. So we're going to say anyone who is inside of our age categories, our 55 all the way to 69 are 3 5-year age band age categories. And we can do that first for the US, so in country is equal to 840. We can look at Greece and then Sweden. And then the actual command that we're going to be doing is just generating a mean. So the mean of R2000 for any ADL. So not our change variable here, but just whether a person has any ADL difficulty at that age. So inside of Stata, let's run that command. So you can see here if we scroll up, so it looks like we would estimate for the US population that around 11% of the people we would estimate inside of the ages that we've defined, which are I think 50 to 54 or 50 to 69 or 55 to 69 are going to have any ADL difficulty in 2014. For our next country, Greece, it looks quite a bit lower. So it looks like around 4.8% of people, again, of the same age population inside of Greece, we would estimate. And then for Sweden, it looks closer to Greece. It looks like maybe not statistically significantly different, around 5% of the people. So although you can do that using 3 different commands, you can also do that using a single command. Stata, there's often many ways to do things, and this is an example. So instead of estimating these 3 separately, we can also change our command to use the optional command over at the end of our command. So you say comma over ISO country. And that'll let Stata know to automatically, for all those values of ISO country, produce an estimate. In this case, we have 3 values for ISO country, for the US, for Greece, for Sweden, and it will produce those automatically. So inside of Stata, we can do that. And you can see here, in a much easier to read output, we have our same estimate for the US, for Greece, and for Sweden. We can look at this graphically. I think graphically is sometimes important. So you can see both in Greece and Sweden, here we have 95% confidence intervals. They look fairly similar right there at 5%. And the US is definitely more than double, or looks close to double those two. All right. So the next step is we're going to be analyzing disability onset. So I said we're going to be looking at something longitudinal. So let's take exactly the same code that we used before, but instead of looking at our any ADL variable, let's look at our change variable. So the mean of any ADL change over ISO country. So if we jump to Stata, you can see here our estimate for Greece would be around 4% of the population would experience some change, around 8% of the population in Sweden, so a little bit higher, it looks like, than Greece, would experience change, and around 11% of the US would experience change. If we look at that graphically, it would look like this. So interesting, what we see is that for the US, even though people in the US started out with almost double the amount of initial prevalence, so of anyone having one, of those people who didn't have one in 2004, which was a smaller subset of the US, we would estimate that still a lot more of those, certainly than Greece, are going to acquire some kind of difficulty within the next 10 years, right? So 10% of people we would estimate in the US in our age range are going to acquire some kind of difficulty in the next 10 years. Next, let's look over our age cohort. So remember, we created these age variables, and it might just be interesting to see if we see different trends in different countries for age cohorts. So we could do this quickly in Stata, and I'll show you quickly in the command. All we've done in the command here is that instead of just having over ISO country, we've added another variable, which is our age categorical variable. So that's the only thing extra that we have to do in this step to look over each country. And what Stata is going to do, it's basically going to cross-tab country and our age categories. In this case, to get an estimate for each country, each age category, we have 3 countries, 3 age categories, we're going to get 9 estimates. So in Stata here, we can see our 9 estimates. It's going to tell us what each estimate is. So subpopulation 1 is for Greece, people 55 to 59, all the way through subpopulation 9, which is USA 65 to 69. So we can see these changes here. Let's just look at this graphically, which might be a little bit easier to see. So one of the interesting things that we can see is that people in Greece have very close to no change until they hit the 65 to 69 range, which I think is really interesting. And in the Sweden and the US, you kind of see a more gradual progression, although in the US, it seems to be maybe not statistically significantly, but at least the estimate is a little bit higher at each level than it is in Sweden. And certainly one thing you can see here is that in the confidence intervals, our standard errors are going to be smaller for the US because we're able to estimate with a little more precision there because we have bigger sample sizes. So as I mentioned, we're going to look over a couple of factors which you think might be associated. And the first one is going to be gender. So we're going to use exactly our same command, and we're going to say ISO country. Instead of age category, we're just going to include our gender variable here. And then what we're going to do is we're going to test the difference between 2 of these groups to see if they're statistically significantly different. So this is kind of a difference in difference measure. So we're going to say, is the difference in the US between men and women significant? And is the difference in between men and women in Sweden, is that significant? And whether there's a difference between those 2 differences. Don just asked, could you provide syntax for the graphs? Yes, Don, I'm happy to. I will just, it's a little bit harder, so I'm not going to share it on the website later, but I will email it to you. If anyone else would like the kind of the graphing programs that I use, the graphing syntax, just let me know here in the questions or the chat, and I'll drop it in an email to you after the webinar today. I'm happy to provide that. So back in Stata, if we type Q here, we're going to get our estimates. In this case, we'll get 6 estimates because we have 3 countries, men and women in both. And then, so we could estimate for, let's look at US men versus US women. We estimate about 10% of men and 12% of women are going to experience disability onset over our 10 years. And then for Sweden, which we're going to compare, it looks like for men, we would estimate about 9% of men and only about 8% of women. So it looks like the pattern is a little bit different between Sweden and the US. In Sweden, men are experiencing higher rates of onset disability, and in the US, women are experiencing higher rates of onset disability. So using this test command, this is called a post-estimation command, so we can test whether the estimate for subpopulation 5 is different or equal to the estimate for subpopulation 6, and really we're testing whether they're equal. So we're making the assumption that they are equal, and then what Stata is going to do is it's going to run an adjusted wall test and let us know whether they are equal or not. So the probability greater than our F statistic here is going to be 0.3011. So it's greater than kind of the 95% confidence, but we couldn't say with the 99% confidence. So there could be something there that we might want to look into more. And if we look at our difference for Sweden, whether it's statistically significant, we can see that it's definitely not statistically significantly different. So although it looked like there was kind of a pattern, and we can look at that graphically, a pattern for Sweden, and it could be because our sample size is smaller for Sweden. But anyway, using this sample and this question, we're not really able to say that something, there's kind of a gendered association difference here with Sweden, but it does look like there could be one here for the US. So the next question is, we'll look over urbanicity. Again, this will start to look very familiar. So we're just going to look over country and our urban variable, our urban rural variable, which is named H2004 rural. We can do that in Stata by typing Q. Again, we'll get 6 estimates for our countries. We can look at that graphically. And you can see that it looks like, surprisingly for the US, it looks like there's no association in the differences between urban and rural. They look almost precisely the same, and certainly taking into account your confidence intervals, doesn't look like there's much of an association happening between urban and rural for disability onset. So let's look at another one of our variables, which was education. So again, we have this same command. The only thing we're going to change is our education variable, so RAEDUCL here. So we can do that inside of Stata. We'll get, in this case, we're going to get 9 estimates because the RAEDUCL variable has 3 categories of education. They are less than lower secondary, upper secondary and vocational, and tertiary education. So we have those 3 for each of our 3 countries. If we look at that graphically, one of the things that we can see, which is really striking, is in the US, how much association there is with your educational level and whether you have a disability onset. So people who have a less than lower secondary, meaning in the US they did not graduate high school, we would estimate around 20% of those people would have a disability onset over 10 years. People in the age ranges of 55 to 69, which seems really high. Of course, for people who have tertiary education in the US, it's right about 5%. So you can see this like strong association with education here in the US. And it looks much different or not statistically significant in both Greece and Sweden. And lastly, the last thing we'll do here is we'll look over wealth, kind of our last factor that we wanted to look over. So again, we're going to use our same command. We could also use kind of a test here between low and high wealth. We could compare this time the US and Greece, looking at differences. So our same command in our over option, we're going to say over ISO country, H 2004, A asset, total asset, so ATOT, and our tertiary one. So we have, in this case, we're going to get 9 estimates again for low, middle, and high wealth for each of our 3 countries. And we can test those differences. You can see here in our 2 tests, the difference in the US seems very statistically significant, and the difference in Greece does not seem statistically significant. If we look at that graphically, again, we can see something which maybe mirrors something that we saw with education also. We know that education and wealth are kind of highly correlated. And again, we can see, although our estimate for our low wealth is lower than our estimate for low education, but around 15% of people in the US with low education, with low wealth, we would estimate would have some kind of disability onset over 10 years. And while it's still more like 5% for high wealth. And although there looks like there's maybe some association, it's definitely not statistically significant for Sweden or Greece. Of course, in this example, we've only kind of calculated different means. To kind of do a more thorough analysis, you might want to take all these factors that we looked at and additional factors and put them in a regression together. So then we could start to attribute, what percentage of this difference that we're seeing in ADL onset perhaps is driving from wealth or for education. When you hold education, when you hold wealth constant, or wealth when you hold education constant. So that would be kind of an interesting next step, which we won't get to now, but that would kind of be the next step in this analysis. So that's going to wrap up this webinar. I hope that you learned a little bit about the Harmonized HRS, which we were excited to get released this week, and also the Gateway to Global Aging Data, this set of studies. They're called the HRS Sister Studies. To learn more, you can visit us at www.g2aging.org. As I said, we have links there on that download page to all of the data sets where you can download data for all the different countries. We also have a help desk. It's help@g2aging.org, and you can email us for any questions. We always try to get back to you within 24 hours, whether that's a question about getting started in your research, getting access to data, using the Gateway to Global Aging Data website, using those harmonized data sets. We're happy. We have a team of people here who work on it, and so we're happy to help. I see that I've gotten a lot of requests for the graphing program, so yes, I'll certainly email that out. Also, I've recorded this webinar, so I will, by tomorrow, on the Gateway to Global Aging Data website, on the documentation page here, you can see we have this section called Recent Presentations at the bottom. So I will have up both the slides from today, a link to the video from today with my voice and the slides, and then also this data code that we used today. I'll put that all there. By tomorrow morning Pacific time, we'll get that up. If anyone else has any questions, more questions, I'm free to hang out. Again, you can ask them in the question box or the chat, or you can raise your hand and I'll unmute you and you can ask them, and I'll hang out here for as long as people have questions for. But thank you for joining. Also, I think as you sign off, there'll be a brief survey that you can answer about today's webinar, whether you liked it, if there's anything else that you'd like in additional webinars or something you would like changed, you can let me know. So if you could fill that out, that would be great. Thank you again.